set to go.
Good to start. Thank you, Barbara. So welcome to Board of Health meeting. Where did my agenda go? Sorry, guys. On Friday, April 9th, and I'm going to read the governor's statement for our meeting. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the governor's March 15th order imposing strict limitation on the number of people that may gather in one place, this meeting of the Southborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with the right and/or requirement to attend the meeting can be found on the Southborough website. For this meeting, members of the public who wish to watch or participate in the meeting may do so in the following manner by finding the meetings at Southborough virtual meetings link. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite our best efforts, we will post on Southborough's website an audio and/or video recording, transcript, or other comprehensive record of the proceedings as soon as possible after the meeting. Okay, thanks, guys. Welcome. I don't think it's going to be too long of a meeting. Thanks for jumping on. Shorter than our past one, and I want to talk about like future meetings too. Just get some thoughts on that. I thought that Dr. Heather could give us a little bit of an overview on what's going on the coronavirus front before we get started into our agenda.
All right, so just for an update, I think I mentioned last time we're applying for a shared services grant. There's 4 towns who are working together, Northborough, Southborough, Westborough, and Boylston, and we should hear about that next week. That's mainly for inspectional and nursing services. The COVID cases, unfortunately, still continue to rise. Last night's numbers is the second week in the row for reporting that we're back in the red. We were in the red in February, and then we came down at the end of February and March. And then we hit 1 week of green. Each week there's a report. The report covers a 2-week period, the prior 2 weeks, but it's a weekly report. And then we went to the yellow for a few weeks, and now we're in the red in the past 2 weeks. The case count for the 2 weeks is 27. I believe the prior was 25. And 25 or higher for a 2-week count is in the red for Southborough. We continue to see cases in, 30-year-olds and below, a couple 50-year-olds, but 30 and below. Unfortunately, we have cases in the public schools. We have cases in the after school. We have cases in the private schools and the boarding schools. And we even have a case with a fully vaccinated teacher at one of our private schools. So we have been following daycare clusters. We have been following private school. It's very tricky with the boarding schools in the sense that the boarders are going to count into our numbers. So that's a few cases that, are putting us a little bit higher with the boarders. And, without the nurse, I'm doing that by myself. There's not really any other folks to work on that. So we're following the boarding schools.
Talk about the complexity of the private schools and the international students and how.
Right. So there's 3 different schools in town that I consider private, and they all have different kind of procedures, and they're supposed to kind of register with IHE Higher Ed about whether they're going to do their own contact tracing. Generally, schools do their in-school contact tracing, but they provide that list to me. The borders, it's for one school, if they're positive, they have a house where they can isolate. For a different school, they don't have a house where they can isolate on campus. So these students who are basically from all over the globe, because it's a private boarding school, are coming with positive, when they have positive tests, are then our jurisdiction, their borders. So that's their address, and they count in our numbers, like I said, but they also count in our numbers in terms of following them for their isolation period. With the isolation, some of these parents, are far away, and they're getting relatives to take them off campus and then drive them somewhere. Obviously, they're all told not to fly, but it's very tricky following these cases because they're changing location. They're starting at the school, then they're going somewhere, then they might go somewhere else. And the guardians are changing. And when someone's under 18, the tracing is through the guardian or parent. So it's a lot of work for me to try to get those numbers so that folks can trace them. And then there's potentially, 20 contacts. Those contacts don't necessarily live in Southborough. So, the Maven system with trying to task the other towns, reach out to other towns about these contacts can be time consuming for me. So I'm trying with that. And unfortunately, I don't see a huge end in sight. We did just have Easter, so I don't think the next week or two is going to be any better. The youth, the fatigue, kids who are sent home on quarantine, you're hearing that parents aren't really, cooperating with that. So I think the private schools end, sometime in May, so that might be good. We're working with them on also trying to message or something with the families to work on that. The public school has great school nurses and oversight, and but they've had sports teams. Private schools have had sport teams, and so it's a lot of quarantining and contacting. We keep in touch with the public school every week and at a minimum, and we do need to think about metrics in terms of the public schools are coming back full time. The kindergarten to 5 is already full time. The middle school and high school is set to at the end of April. I'm just thinking in terms of metrics with if a significant number of students are quarantined, what does that really look like for the educational experience? But the in-school transmission is very low, as I said before. So, plans are on that way in terms of safety. We really feel with the data that there's safety, but there is sort of these operational logistical challenges with quarantining folks. The pool testing obviously picks up some positive, generally it's household contacts. So, but then there's kind of the logistical piece with quarantining. So those are the schools. And like I said, that's where we're seeing the most cases now are in the youth.
One of the things too that's created a challenge in Framingham is the transport. So you think about a school bus.
Oh,
right?
I was going to say that the buses,
they
van.
don't have assigned seats. And so you have to quarantine the whole bus if they don't have assigned seats. Even the private schools have vans where they transport kids to sporting events and all of that. So tracing back to who were in the vehicle with them creates a challenge.
Right. And it's a challenge in many things. They don't, the vans, they don't always have such great compliance and cooperative with the tracing. And also like the public school buses in Northborough, Southborough, they have a camera that you're trying to find out, we're trying to find out from them, who are the kids who were next to the seating charts change, who was next to this kid. They have a camera apparently, and it's a VHS tape, and it takes like a week for someone to look at it. So it's very tricky trying to get the contact lists from the buses and the vans, but all true. So anyway, good news, we are getting vaccine for our Westboro Doubletree site. It's a regional site with 7 towns. And it's really nice to be working together with the other towns. And as these things go, you know, just kind of rapidly, we, I guess, found out yesterday that we were getting 1,500 doses of Moderna to start our clinic next week. And then I got emails early this morning. We're actually, Northborough is getting the vaccine today. So I am meeting at 10. We're trying to get together clinics for next week. So we have the vaccine and we're doing Moderna clinics starting next week at the Doubletree. I think it's 1,500 doses next week. So we've got a color computer management system we need to learn. We're hiring admin staff, and we're coordinating with the towns about staffing. The vaccinators are generally the paramedics from each town, and MRC certs are being used who are able to commit to at least 1 day a week, you know, weekday, to try to get a consistent staff. But the MRC certs from our town, I think 8 of them are able to help us.
And people sign up through the MassVax website?
Right. So so there is potentially going to be sort of a side clinic registration that is split between the 7 towns that I'm going to be talking to people today, and I'll be talking to folks today that potentially, you know, we could put on our website. But the vaxfinder.mass.gov will have our regional site on it. Yeah.
Great. Thanks, Heather. Nancy or Dan, do you have any questions for Heather related to all the?
No, not for me.
Nothing
Heather.
for me.
Okay. Thank you. All right. So I wanted to make a motion to vote to approve Taylor West contract. You guys both got the contract?
Yes.
Reviewed it? Great.
Yeah.
Yay.
I have Taylor's signature here.
Oh, perfect. So to approve the contract for Taylor West, anyone second?
Second.
Any discussion? Does anybody have
No.
any questions about that contract, the language or anything? No?
No.
No.
Super. Thank you. So I'd like to vote to appoint Taylor West to the full-time public health nurse position at $43.27 an hour to start a little modification, Heather, start 4/20 because 4/19 is a holiday.
Patriots. Yep.
So, right. So
I vote yes.
Nancy votes yes. Dan?
Yes.
How do you vote? Great, super. So Taylor will start to get up to speed and get her email and start to get whatever she needs so she can hit the ground running to help Heather. That'd be great.
So Nancy and Dan, can you swing by sometime this next week to sign it?
Yes.
Okay.
Yep.
Get in touch with me. Let me know when you're available. I can work around your schedules.
Okay.
Okay.
And then Mary Lou, I will get it to you. You sign it, get it back to me, and
Sure.
done.
Will
Are you
do.
gonna be home
Thursday.
Thursday? Okay.
So I'd like to make a motion to appoint our temporary clerks to help with the vaccination.
Right. I just heard this
Okay,
morning their
right.
queries were clean. Their queries were clean. Barbara
Great.
and I did the queries yesterday. Ingrid Mance, it's M-A-N-Z,
Okay.
and Dina Zibel, Z-I-B-E-L.
Okay. Any discussion, or I didn't hear a
Questions?
second.
Second the motion.
Thanks. Any discussion?
No.
No.
So I vote to.
This was part of, right, this is part of the way that we were going to run this for the town, that we were sharing kind of the hiring for admin staff. This will be money that's reimbursed for the town, but one town can't oversee hiring in the sense that one town would be paying them up front before the reimbursements. So each town is doing some hiring. We had strong applicants compared to some, so we're kind of working that way. But in terms of the hiring,
Great.
Okay, so we're hiring 2 temporary clerical staff that will be refunded by the state. So it really is no money out of
NEMA.
the
Mhm.
our current budget, and that's great to have some support to help with that, all the logistics that go into doing that.
Right, and we
So,
can contribute this. There's a lot of things we can't contribute, like that other
Right.
towns are contributing IT support. We don't have one in place. This we can contribute, I feel like.
right.
Mm.
So I'd like to vote to hire the 2 temporary per diem clerical staff. Nancy, how do you vote?
Yes.
Dan, how do you vote?
I vote yes.
Okay. All right. Now for our other more important discussion. I would like to make a motion to modify our FY22 budget.
I second the motion.
Okay, so this is going to be, there's a little bit more discussion on this. So to explain, the challenge that we've run into, sort of there's a recognition that, that we know that we need a full-time health director, a full-time nurse, and a full-time admin. And how do we fund that when it's such a substantial increase from our 21 budget to our 22 budget? And in a lot of the discussions that have gone with, I met with advisory, met with selectmen, how do we allow us to have those positions and yet maximize the external funds that are available through CARES Act, maybe some stimulus money, maybe some other money from the state? If we have a budgeted position, we can't access that money. So if our 22 budget has a full-time director and a full-time nurse, we can't access those CARES Act funds. So I had a long discussion with Kathy Cook from advisory yesterday, day before, I don't know, all the days kind of run together these days. And we thought of the current situation with Taylor is how we had the ability to hire Taylor full-time with benefits was that advisory took a vote to backstop basically any money that wouldn't be covered by CARES Act or by other state or federal funding. So they're willing to use out of the reserve fund to cover that so that she could work full-time through December 31st. So thinking that same philosophy, we said, okay, can we apply that to the health director and the nurse to go to June 30th of next year and still access even CARES Act funds right now only goes through December 31st. So then we're left with how do we cover January to June? Now there could be potentially other money that's going to cover that we don't know at this point. So one of the solutions was let's just hire these full-time people through December 31st. And I'm not comfortable with that. That leaves too many things up in the air, too many questions. There was discussion about having a fall town meeting. We can, I want to get your thoughts on that too. But the tentative solution that right now I want to take a vote from you guys is that the public health nurse and the public health director would be hired full-time with benefits through June 30th of 2022. And if advisory votes to backstop that and cover that, would you guys be willing to leave the budget with the current, 15 and 19 hours that Paul was 19 and Leslie was 15? Leave the budget there so that we can get access to those funds later.
Yeah, that makes sense.
And they can get benefits or no? I'm confused.
Yes, absolutely.
Okay.
Full the same, full benefit as if it was fully, on the budget, it's the same. It's
Okay.
going to be the same for them, full benefits. They'll be a full-time employee in the town. It's just where that funding source comes from. So if Advisory is willing to vote to backstop that, then we still get the full-time position for the full fiscal year for both people. Do you still
Okay.
have a question, Nancy?
No,
Or-
I'm just processing it.
Right?
Yep.
So, so I wanted to, do you guys have any other questions related to that? If I move to make a vote to do that?
Can you just,
No.
it's gonna go until when?
June 30th of 22. So the
Okay.
full fiscal year,
Okay,
which would be the same as the 22 budget would have
Right.
been. But
and
without,
then what do we do next year? Well, we'll
Well-
worry about that then, yeah. I mean,
well, you know,
because
in
there
order
won't be CARES Act money forever.
Correct.
Yeah.
So in order to fund those two positions in the 23 budget, will have to, be increased to cover those.
Okay,
But it won't be such a huge jump, which is what they've kind of been everybody's been
Right.
asking, can you do an incremental increase instead of this huge jump, which doubles our budget? And so this would allow, so we have the other increases of our other things, right, that are slightly increased. So it would be slight increase in our budget, but not a huge increase for 22. And then 23 would be another increase to continue to fund those two positions.
okay. Yeah, as long as they're aware we're gonna be needing that increase in a year.
Well, right, and also I want to take a vote to approve this strategy of keeping the current 15 and 19 hours for the health director and the nurse in our 22 budget, with the caveat that Advisory does agree to it. Because if Advisory doesn't agree to it, I would like to go to town meeting for that.
I agree.
So.
Yeah, I think that's a well-constructed plan, Mary Lou.
I do
Okay.
too.
So I'm going to take a vote. Nancy, well, how do you vote?
Yes.
Dan, how do you vote?
I vote yes.
And this is Mary Lou, and I vote yes. So that's the health director and the nurse position. The other position is Barbara. So Barbara currently is 24 hours with the Board of Health and 16 hours with assessors. So when Barbara's been working more hours with the Board of Health, we can't access CARES Act for that because she's already works for the town for the 40 hours. So it would have to cost the town more money. So if Barbara works over 40 hours, that's reimbursable through CARES, but up to 40 hours is not reimbursable through CARES. So what Kathy Cook had proposed was that we leave Barbara at those current two rates, the 24 and the 16, and the assessor's office was willing to let her work at the health department as much as needed throughout the 22 fiscal year. I'm not as comfortable with that because there's we can't access CARES Act to help support that. We know we need a full-time position. So I wanted to get your thoughts on that. I would like to keep Barbara in the budget at full-time on the Board of Health budget.
I think we need her full-time, absolutely.
Right. I think
Yeah.
we all know we need her full-time, but is it the strategy that we discussed for the health director and the nurse doesn't really apply here with Barbara?
Right. And can you repeat what the expected hours were for Barbara?
So Barbara is
Working.
in the 21 budget, well, actually currently, Barbara is 24 hours with the health department and 16 hours with the assessor's office. But she's been working, Barbara, you can let us, you've been working pretty much 40 hours with the Board of Health, correct?
At times, it all depends. I do give my time to the assessors, and I know Paul Sabelli we're looking at ways where I can get access to certain databases too, like Patriot and Vadar, which I need for the assessors, and he's willing to still split. And if you're saying that they're looking at shifting, having admin people be split, I kind of feel safe being split right now. I don't know where I'm gonna wind up. That part's a little scary.
Okay. So
So
you're,
you'd prefer to just leave things the way they are, Barbara?
I think right now, because if I'm hearing things that that Mark Purple's looking at splitting admin positions, the Board of Health, and I don't have to do the assessors meetings. But if I get onto another board, then I'll have to do their meetings as well, and that'd be a lot of meetings to do tonight.
Yeah,
just a
that
little
I guess was
cautious
a
about
key
that.
component. That was key information to share, like that Mark Purple's looking to split admin positions. So knowing that, I think
Or
that
share, I mean, he wants to
Yeah.
share them.
Yeah.
right.
right,
Right.
yeah, share like you're doing right now.
Mhm.
And if you come to the Board of Health full time, you might have to split your time with a different department later on, is what you're saying.
A different board even, yep.
Yeah, okay. And you're comfortable where you are, and
I am,
you've got
and
the experience with
can
the
also,
assessor and the Board of Health.
yep, and I'll be working with the building department on building permits and stuff. So I mean, that's gonna be a lot to do. And Board of Health meetings, I think one meeting is enough for me. I'm just stating. I don't know where I'd wind up helping out, so.
So you're saying stay full-time with the health department?
Well, I think it should still be split, because if he's going to start sharing the admin people, then I'd be
Yeah,
doing.
but if you're split, so on days when you're supposed to be, what we need help at the health department, we need someone there full-time. So if you're need to do assessor work, who's going to be taking care of the health department?
I can still do things.
But my concern is being split, and having, like you said, the responsibilities of both offices to manage things when, even like our work with the building department, we're behind on, and the trash haulers, there's so many things that we, are going to be coming up on our plate.
Yeah, I know. But
So Mary
we
Lou,
just kinda wanna
what
see
about,
what, hun?
Go ahead,
what
Dan.
if, are you proposing then that she's officially a full-time admin for the Board of Health, and that if Mark Purple decides to share admins, that Barbara can't be touched? Do we know that?
Well, we have control over that part. Mark would have to come to us and ask us to share her. And if we need her down there full time, I mean, obviously we want to help as much as we can in town, but no, I don't see that happening, Barbara. If you're full time at the Board of Health, I don't see you being pulled away to do other things. I don't see that happening.
No, I don't know.
But what about
hearing
in a
like
year
other
or
boards.
18 months?
Sorry, Dan?
What about 12 to 18 months from now? And I think that's Barbara's probably concern.
Right.
Yeah.
Like, she's busy right now because of COVID has added a tremendous amount of work to her, normal duties, right,
Right.
Barbara?
Yes.
And then will any of that subside over 12 to 18 months from now? And then if it does, how does that impact our argument to keep her on full time?
So that's a good point, Dan, but honestly, there's so many new things that are coming on our plate, and our expectation of, meeting these blueprint improvement of public health. I just think there's so much. And then having our health department open 5 days a week. I mean, it's just, we need someone there to answer
Yeah.
phone, triage all the information. We have firemen that sit in the fire station, for days and days and days waiting for something that in case it happens. We need to be prepared. We need to have someone in the office in case there's an
Yeah.
emergency. I mean, Dennis explained 2 things that happened just this past week, and he wasn't available, wasn't there, and had to try to figure it out. I think part of this movement to to shore up the staffing and the core structure and the infrastructure of our health department is to make sure we're available to do things when they're working without being open 5 days a week. I don't know how we can do that effectively.
Yeah, I completely agree with you, Mary Lou. And I just want to make sure that we have our bases covered if that were to come up again in 12 to 18 months. And what would our argument against sharing our admin be? So I think you just said it right there.
Right. And I think at that point, come next spring, Barbara's going to have a clear picture of what, what she's working on. So, I mean, it's going to be clear how much time is needed to do whatever needs to get done. I don't think
Right.
there's any time when
Yeah.
Barbara's twiddling her fingers.
Yeah, no, you're exactly right. Yep. Okay. Well, Barbara, with that said, how does that make you feel now with your concern?
Well, I mean, this still has to be approved by everybody, right?
Oh, right. Absolutely.
So
Yeah.
maybe it's like spaghetti. Maybe you take it, you throw it against the wall and see if it sticks. Easiest way.
So, okay, so I'm going to take a vote to keep Barbara full-time as we were proposing. Keep Barbara full-time on the Board of Health budget at 54 with her upgrade would be 54,000, which would be an increase from our 21 budget to our 22 budget. It would be an increase of 24,962. Nancy,
I vote yes.
Dan, how do you vote?
I vote yes.
And this is Mary Lou, and I vote yes. So that line item will go from the 30,000 to the 54,000. And then her longevity would actually still be in there. So Barbara and I are going to clean up this based on our discussion today and send it back out to you so you can see it, in the
Okay.
table form with the
Okay.
the new numbers in place. The other two areas that has been areas of contention or concern was the $10,000 we have in that line for our printer, scanner, faxer,